In the next 12 months, 54 million people will die. Death is universal, and the fact that we will die is commonly understood, yet the idea that sick or dying people would intentionally choose to hasten the time of their imminent death seems strange and controversial to us. With the rapid advancement of medical technology, life support and life-sustaining mechanisms have become more advanced and effective at keeping people alive who may otherwise have died naturally. In the face of these advancements, some have pushed for the right to die or euthanasia. Euthanasia is defined as a deliberate act that causes death undertaken by one person with the primary intention on ending the life of another in order to relieve that person's suffering, also known as physician-assisted suicide. It can take on the form of active euthanasia, which is lethal injection or medication, or passive euthanasia, which is withdrawing life support or failing to treat a disease. The euthanasia movement has gained momentum in recent decades, spurring various laws and legal precedents surrounding the practice. Furthermore, in the argument is the ethical issues. Most of us would never think of asking to die, but is it still a moral option?
One of the most important arguments of anti-euthanasia advocates is the Hippocratic Oath, which is the Greek code of medical ethics that was developed between the 3rd and 5th century. The code states that, "I will neither give a deadly drug to anybody if asked for it, nor will I make suggestion to this effect."
The growth of Christianity in Europe changed things considerably, introducing the concept of man's duty to a higher entity. It was common for suicide to be treated as a crime and for euthanasia to be reviled as a mortal sin. During the Enlightenment, a change in values led many to believe that laws penalizing suicide were unjust and failed to establish a compelling interest for the involvement of government. From this point, moving into the modern era, the debate about euthanasia and assisted suicide became framed primarily in the language of personal liberty and natural rights that had become the ideology of the age. In the face of remaining religious beliefs, the controversy's battle lines have been taking shape again, forming up around legalism and individual liberties.
This case presents the question whether dying citizens in full possession of their mental faculties at the threshold of death due to terminal illness have the liberty to choose to cross that threshold in a humane and dignified manner.
In 1997, the Supreme Court case Washington v. Glucksberg, Dr. Glucksberg filed against Washington state's ban on physician-assisted suicide on the basis that it violated the Constitution's Due Process Clause and the 14th Amendment. The Supreme Court unanimously voted against Glucksberg, holding that the asserted right to assistance in committing suicide is not a fundamental liberty interest protected by the Due Process Clause.
There have also been cases concerning non-voluntary euthanasia. The most well-known is the Terry Schiavo case, which brought up the issue of when the patient is unable to express their wishes, who the decision falls to. Another case like this was that of 1990, Cruzon v. Missouri, where the state of Missouri refused to let the parents of Nancy Cruzon to terminate life support, stating that there was a lack of clear and convincing evidence that she wanted to be withdrawn. The Supreme Court narrowly affirmed the decision and established the legality of ceasing medical treatment for incurably ill patients, at least under certain circumstances.
Additionally, the case of Enright Quillian established the right of an individual to forego life-sustaining treatment, stating the individual's right to privacy. In fact, pro-euthanasia arguments cite that right to privacy guaranteed by the Constitution and supported by other court cases, specifically Planned Parenthood v. Casey, which decided that people have the right to make decisions about matters involving the most intimate and personal choices a person may make in a lifetime. In the eyes of many euthanasia advocates, this would also include the right to die in a way a person chooses. The case law history of euthanasia in the United States is extensive, but interestingly, outside of the United States, there is less discussion on euthanasia.
According to the article International Perspectives, the majority of the nations have outlawed euthanasia. In fact, the topic is rarely debated outside of North America, Europe, and Australia, although there are a few exceptions. Now, there are some countries that have outlawed euthanasia but allow assisted suicide. One such country is Switzerland. As a result of this law, they have been having a problem with suicide tourism, which, according to Stephen Ertlet, has risen by 700% over the past 11 years.
Currently, according to International Perspectives article, euthanasia and physician-assisted suicide is legal in 3 countries. The Netherlands adopted it first in 2001, Belgium in 2002, and then Luxembourg legalized it in 2008.
Now in 2010, G.K. Kimsma, a medical philosophy professor at Free University in Amsterdam, did a study on the euthanasia law in the Netherlands and found that due to the strict criteria of the law, there are about 10 times more requests than there are actual cases of euthanasia each year. He also found that 95% of the physicians said they would act the same if they had to euthanize patients again, and none of the members interviewed had regrets.
The idea of whether human euthanasia is morally right or wrong is a heated discussion. Of course, as with anything in this country, it is divided politically as well. As you can see, when the topic is divided by age, it is nearly even. This is a major reason why the issue is largely debated and highly controversial.
Within specific professions, such as the medical field, the issue is largely debated.
But euthanasia in and of itself is the active taking of one's life. As physicians, we're trained under a number of ethical principles, and one of them is autonomy. And this is a slippery slope because you do want to respect somebody's wishes, you do want to respect somebody's beliefs and values, and if someone's suffering, they should have the right to decide what to do. However, we're also bound by other principles such as beneficence, where it's the ability to do good and to promote health and well-being, and maleficence, which is the ability to, or our ability and promise not to do any harm. And as a result of that, to actively take somebody's life does appear to, violate those principles.
On the other hand, Dr. Marcia Angel, a senior lecturer at Harvard Medical School, believes that this is not a question of life versus death. It's often misconstrued that way. These people are going to die. Who are we to tell them they must soldier on? In her view, the people who are eligible for assisted suicide are going to die, so they should have the right to choose when they die so they can do so with dignity.
Religion takes on another major moral argument. All faiths offer meaning and explanations for death and dying, and it is an important part of their beliefs. Most religions, including Christianity, Roman Catholicism, Judaism, Islam, and many more, disapprove of euthanasia, and some even forbid it. In Buddhism and Hinduism, euthanasia is disapproved of because it tampers with the many cycles of lives lived before reaching liberation. Virtually all religions state that those who become vulnerable through illness or disability deserve special care and protection, and believe that proper end-of-life care is a far better option than euthanasia. Human life is considered sacred and should be protected and preserved. They hold it is not our place to interfere and violate one's value and dignity, whether it be one's own life or that of another, even if that life is full of pain and suffering.
One additional facet of the controversy that is often overlooked is the toll that euthanasia can take on healthcare professionals. It may feel like an obligation to help those suffering, and this puts doctors in very difficult decisions every day. Despite the illegality of physician-assisted suicide, many healthcare professionals admit to engaging in the practice when they feel that the circumstances require it. Although the American Medical Association takes a public stand against euthanasia, it seems only opposed to its legalization, not its practice.
So where does this leave us? Currently, assisted euthanasia is illegal in most U.S. states. Patients do have the right to refuse treatment and choose pain management treatments or palliative care. In most cases, passive euthanasia may be performed with informed and legal consent. The justices in their decisions in the Glucksberg case noted that their decision stood just for this case, and they may vote differently on another in the future. However, there are still many objections to euthanasia, especially as we see more and more examples of the practice at work in places like the Netherlands. Looking at the euthanasia in the Netherlands, where legalization was achieved through legal case law precedent, such as the 2001 Schoenheim case, it looks quite similar to how the U.S. is handling euthanasia laws to date.
What can we do to make euthanasia less controversial? One step we can take is to restructure medical education to focus more on dealing with pain at the end of life. Although every medical student learns how to deliver a baby, much less focus is spent on the other spectrum of life. Palliative care is in need of extensive development. Undertreatment of pain and depression are common in current clinical practice. In many hospitals, there is a lack of funding, training, or institutional or regulatory barriers to provide patients proper pain treatment, making it difficult for them to receive the end-of-life care they need, which may urge them to consider euthanasia.
Put yourself in the position of some of these patients. You've been told that you have a terminal illness that puts you in an unbearable pain or suffering and will only lead to an undignified death. Or your child was born and needs life support to survive, and it is certain they will never be independent of it. Or your spouse is in a persistent coma. What do you do when it seems like death, one of our greatest fears, is your best option? As long as we live, this answer will be a difficult one.